Hi newbies, Nurse Ruthie here, and today we're going to talk about making mistakes. We are human beings. We are not robots. Even robots make mistakes. But sometimes in your nursing career, you're going to make a mistake. You're either going to catch yourself before you make a mistake, which is called a near miss, or you're going to make a mistake. The most important thing, though, about making a mistake is, number one, learning from it, owning up to it. Prevention is key. Also, be sure to fill out that dreaded incident report. Notify your supervisor, your charge nurse, and depending on the situation, it can be very traumatic. It may take years for you to get over it. It may interfere with your confidence level of taking care of patients. There was an incident where, when I believe one of the Royals, they were in the hospital and someone had called. It was like a news reporter, but they pretended like they were part of the royal family, and they were asking how was the individual doing, and the nurse assumed that it was really someone from the royal family when she found out it was not. Unfortunately, she unalived herself. So some people can have a lot of guilt. The incident report should not be punitive. The root cause analysis should not be punitive. It should be a learning experience. They need to look at the processes. What could have caused the incident to occur? I promise you, a majority of the nurses have made mistakes, big or small. It could have been a near miss where they're like, oh, I grabbed the wrong medication. I almost gave this medication to the patient. Things happen, especially when it's really hectic. That's when things happen. So when you feel oh my God, I'm so overwhelmed, just stop, take a breath, try to slow down. Also, if you find yourself grabbing a lot of vials of the same medication, question that. Call pharmacy, look it up, because it's not very common that you're going to get 5 vials of something out of the Pyxis. This is when your mentors come in, the people that you trust. It doesn't even have to be a nurse. It could be someone in the medical field. It could be someone in your family. You need to speak to them, because who knows, maybe they have been in the same situation or even a worse situation, and they can give you some insight on what could have been done to prevent the incident. And also with the incident report, it's important to fill that out because you do not want this to happen in the future. You want to prevent this, whatever the situation was, not to occur again. And be sure to reflect back, look back at your day, look back and see, where did it all go wrong? What could I have done differently? Was it a staffing issue? Was it a process issue? Or also lack of knowledge or skills? And if it's appropriate, apologize. And most importantly, make amends with yourself. Everyone makes mistakes. Just see the mistake as an opportunity to grow. Just be kind to yourself, learn from it, and move forward. My final tips are these. Listen to your intuition. If you feel like something is off, pause for the cause. And just really look at what you're doing, because your intuition is telling you whoa, something's off. Also, follow your protocols. If you follow the protocol, look up the protocol, even if it takes some time, you will hopefully never get in trouble because it's there in black and white. Follow the protocol. All right, newbies, I hope you guys are having awesome days. You're not crying as much driving home or wanting to scream. I hope you have a wonderful day. And remember, treat people how you want to be treated, because what you put into this world is what you're going to get out of it. Have a great day.